parents. Good evening, Dr. Tan.
Good evening, Justine and Lance.
Thank you so much for joining us.
Thank you for the invitation. Yeah,
it's lovely. Just want to ask you first, Dr. Tan, talk about how COVID-19 has impacted your work in the past year, and if there were any changes in how things are being done.
I think the pandemic has certainly introduced a lot of interesting changes, I think, to how we've been doing our work. And I think certainly with the pandemic, I think at the peak last year, there were a lot of concerns, there were a lot of anxiety for our expectant mothers. They were wondering whether they should be continuing with their follow-up, to our clinics and all that. And I think to that, we have obviously continued to encourage them to come for their regular checkups as much as possible. And this is, of course, so that we can actually give them the level of care that they and their babies actually deserve. And I think in order to keep them safe from COVID-19, unfortunately, I think some of their appointments may have to be rescheduled in order to help them maintain social distancing. And of course, I think along the line of prevention, from catching COVID itself, we have obviously encouraged all our expectant mothers to adopt safe hygiene practices. So to wear masks in public, avoid crowded places, maintain a good level of hygiene, as well as to seek early medical attention when they do not feel well.
Doctor, did you see parents having to cope with increased levels of stress as well, especially when it came to finances becoming a bit tighter for them, or having to deal with just being at home 24/7?
I think certainly there is definitely an increase in level of stress. I think we all talk about the new norm, basically, and I think the authorities are quite conscious of the fact that this may have an impact on our already very low birth rates, in the national birth rates to begin with. And I think there was a survey that was actually conducted by the Ministry of Social and Family Development that reported that about 3 out of 10 respondents in Singapore would actually change their plans to get married or have children, right, with most of them opting to actually delay their plans, and for those plan to delay having their first child and having more children, I think more than 3/4 actually plan to delay this for up to 2 years, right, with the remainder actually being uncertain about how long they would delay their plans. Some have said that they may even actually consider a delay for more than 2 years. And I think the top reasons for the delay that was cited by these respondents include uncertainties about the global COVID-19 health situation, anxiety over economy, the economic and employment prospects, and concerns about the safety of healthcare facilities. So certainly, I think there has been quite a fair increase in the amount of stress.
Would you also say because the construction sector has been impacted quite badly because of COVID, and that means a delay in them getting their flats, that would also play in as a factor? They won't be able to have their children as soon as they perhaps get the keys to their flat.
I think that's an interesting point, because I think obviously there are some people who are putting off their marriage, and obviously the consequence of that is obviously starting families later. I think the saying that it takes a village to raise a child is certainly even more true, I think, during COVID-19 times. Money is one factor. We have also heard, I think news reports last year about how new mothers had to cope with lack of confinement support, difficulties of getting support from the grandparents and relatives due to restriction over household visits, for example. So I think certainly quite an increased level of stress for people who are planning to actually, start a family or to have more children.
And Dr. Tan, just about those increased levels of stress, how would they then affect, the interaction with their newborn babies and young children? And how do we remind those new parents that these stresses, while temporary, are real?
I think there's no easy solution, that's for certain. I think the direct interaction between the parents and the children is probably not an issue. It's more of getting the extended family to be involved. And, as I mentioned, it takes a village to raise a child, and getting that level of support is always difficult. I think On the positive side, we have heard of some people who have actually found some joy with these new norms, including getting more time to stay at home with their loved ones and obviously with their children. We have heard, news reports about people who are enjoying doing their home cooking, baking, eating more home-cooked meals since it's become more inconvenient to dine out. Having some time to actually exercise. And ironically, I think for some of us, actually keeping contact more often with our relatives and friends using virtual and online mediums, right? But certainly, I think nothing beats that of face-to-face, physical interaction. And I think that support is obviously very important. If you've got a very, very young child, you've got young children at home, having the direct interaction is obviously very important.
Are there any other lessons that we can draw upon from the experiences over the past 14, 15 months?
I think to put it in a nutshell, staying positive, I think is a very important thing. Making the most of the situation. I will advise expectant mothers, obviously, to keep healthy, avoid crowded places and maintain social distancing, wearing their masks when out in public, and obviously, sanitizing the hands more often. And also, I think in a news item that you brought up earlier on, about visiting a doctor when you're unwell and seeing a doctor early, basically. The interesting observation I've seen is basically some of the couples I do see in my practice have also been actually keeping busy, right? So-called using the extra time they have at home to actually make more babies, either intentionally or sometimes it's a by the way, all right? So in a way, it's not all doom and gloom for sure.
And Dr. Tan, talk about how the obstetrician and gynecology space has changed through the pandemic. Are we seeing more babies? I mean, you talked about some, some being born, obviously, and more that you've seen. But are there many more babies being born this year overall, or a fewer number?
I believe the authorities has obviously stated that the number of babies seems to be on the decline. But I mean, from a personal perspective itself, I think there's still a lot of things that are changing. There are a lot of dynamics that are actually we're still going through a lot of that. And certainly, I think in my practice, when the pandemic first started out, I did see quite a number of couples who are foreigners, who are expatriates, right, actually going home to actually deliver their babies because, of the uncertainties and also because of the fact that they may have difficulties getting their families, their grandparents to actually come over to look after their children. But I think certainly we have also seen other couples, right, other expatriate couples especially, who found that Singapore may actually be safer COVID-19 wise due to our stringent policies. And in fact, some of them have elected to stay on throughout their pregnancies, and eventually delivering their babies here. So I think a lot of things are changing. As the current worrying news about the possible new wave with COVID-19, I think there's a lot of it is still in flux. I must say.
Yeah. So some wannabe parents, they want to be parents, but they are afraid because they still don't know enough about COVID in case they catch it. If they have children, they may pass it on to the child, and there could be complications in the pregnancy, or if they take vaccinations. We still don't have enough concrete data to say that these kids will be safer. Are these concerns very real? Have you come across parents asking you these questions too?
I think obviously there is a lot of concern about whether vaccination for COVID-19 should be actually undertaken. I think the authorities have been also on the cautious side, advising that obviously once women are pregnant, to actually avoid the vaccination itself. So a lot of it is still being researched. There's very, very little data available. Certainly, I think the authorities have suggested that if a couple is trying to conceive, they may actually want to consider actually having their vaccinations, before they conceive, right? I think the current guidance is for at least a month before they actually conceive. And, there's even some instructions as to basically breastfeeding mothers, right? Whether if they should actually stop breastfeeding for a short moment before or while they're breastfeeding, if they do go for the vaccination. So I think the current guidance suggests maybe about a week of breastfeeding if they want to get vaccinated. So a lot of questions, a lot of concerns. And my advice is, for expectant mothers, if there are any clarification which they require, it's best to talk to their doctors.
Yeah, it is, isn't it? Like us talking to you right now. Dr. Tan Eng Loy, obstetrician and gynecologist at the EK and EL Women's Clinic. The inaugural Singapore Parenting Festival is also jointly organized by MediaCorp and the Asian Parent.